So what is parts and memory therapy? So parts and memory therapy has the assumption that some of our emotional responses to things are learned. They're learned emotional responses. And if we can go back to these moments and take the emotions out of the memory, our present emotional response isn't as loud. So this is helpful for things like depression, anxiety, incredibly helpful for things like PTSD. It is also assuming that the self is not unitary, that we are comprised of different parts. So it can be an inner child, it can be your depressed part, your sad part, your angry part. Well, if we want to reduce reactivity, well, we would find that part of your personality. And with that part of your personality, we could go back to emotions that contribute to that overall emotion. So, for example, if you got in an argument 100 times, the 101st time you have that argument, say it's with your spouse, you're going to feel a lot of emotion. From all the other times, you're like, not this again. All the past feelings come up and amplifies that present experience. But if all of that has been neutralized, then it's like you're engaging in this argument for the first time, emotionally speaking. Cognitively, you might remember everything. So let's say I get mugged in an alley, a year goes by, and I have a panic attack when I walk by that alley. That has everything to do with my memory. But if I neutralize the emotions, and that memory is like a 0 out of 10, there's no distress with it. If I walk by an alley, it's a cognitive decision whether or not I leave. So I'm with my friends, I'm with people, I'm fine, I'm safe. Or it's nighttime, I'm alone, this is dumb, I'm gonna leave. So the ability to protect yourself is absolutely still there. Parts and memory therapy was developed by Jay Norix. There's absolutely a precedent for it. There's other therapies that go back to memories and neutralize, or rather decrease, the subjective unit of distress. EMDR does that through bilateral stimulation. It impacts the memory through taking advantage of memory reconsolidation. When we remember something, our neural synapses open up, and after about 5 hours, it reconsolidates. So when you remember something, you are actually remembering the last time you remembered it. Interesting, right? But because this activation and reconsolidation is happening on its own, we can take advantage of that in therapy and take the emotions out. So when it comes to trauma therapy, there's this misconception that it has to be weeks, months, years, that it's a long process. And it can be. It can. Particularly if there's a lot of moments of trauma, a lot of memories of trauma. But also, there's this approach of memory reconsolidation and taking advantage of that through parts of memory therapy, where something that was traumatic at the beginning of session, at the end of session, is no longer traumatic. Something that was an 8 out of 10 or would contribute to panic attacks when talking about it is now like a history book, something that happened but void of emotion. That can be done in one session. Now, it kind of takes a little bit to get that place. Therapists don't generally start the first session there, but it can be done quickly, and multiple memories can be done in one session. EMDR is something that's similar in the sense that it takes advantage of memory reconsolidation, but it has a different mechanism of change. Also, it doesn't have the assumption that the self is not unitary. It doesn't have the assumption that we have different parts of who we are. That's also an important part of parts and memory therapy. So think of like a combination. If you're a therapist, you might find this interesting. At least if a combination of internal family systems and EMDR, but with a different mechanism of change and less of a box of how someone defines their internal world. Doesn't have to be a fighter. Doesn't have to be this, doesn't have to be that. We learn from our clients what's going on. So in my opinion, I'm obviously biased. I teach other therapists how to do this approach, but in my opinion, it's the fastest as far as taking the emotions out of a memory. It's the fastest at healing. If you're interested in this approach, if you're in Nevada, there's tons of therapists in Nevada that can do this approach. Outside of Nevada, it's not well known. I want it to be. If you would like to do some research about this, please let me know. This needs to be researched. I can tell people about it, but the research is super limiting and it's got to be researched. So, or if you are seeing a therapist and you're like, hey, I heard about this approach. I want to do this thing, and they're up for it, I will train them. I hold trainings. I teach others how to do this. I want every therapist to know how to do this. It's cost effective. And it's really cool to have this change be so quick. To have someone go from like insomnia to not having insomnia, or having nightmares to not having nightmares, just to see this rapid shift, that's amazing. It's not like that with everything, but it's common enough that it's normal for us that do this approach, and it's super rewarding. So if you're a therapist, you want to learn how to do this, hit me up. If you want your therapist to know how to do this, send them this video. They can be critical. That's fine. Be critical, be skeptical. Come learn about it anyway. Try it, do it, feel it for yourself. Yeah, this is what parts of memory therapy is. It's taking the emotions out, working with different parts of who we are. So if we're depressed, we work with that depressed part of us, go back to depressed memories, heal those memories, and that part of us that feels depressed is less bothered. So when we're in that mindset, we're not as triggered. So our present experience is lessened, as far as our present experience of depression is lessened. But it can be done with multiple emotions. It also can be done with addiction, going back to the first time you used a drug and taking the emotions out of that, so there's no more reward when you remember using. It takes away the chase. That is helpful. So this is the gist of it. I hope you found this insightful, and please click like and subscribe. Thank you.